Our next speaker, you can follow along if you have the little brochure or the expanded one, Natalie DeVille. And again, we're going to read along because it's easier for everybody, I think. Medical social worker at Lutheran Family Services, Rocky Mountains, where she's care manager for the Older Adult and Caregiver Services program. Natalie has been in the Denver area for 13 years and has worked in a variety of settings, which includes hospitals and nursing homes. And as a care manager, Natalie focuses on supporting older adults and family caregivers through the aging process by being an advocate, navigator, love that word, and a resource person. And if there's, how many people in the room, just by show of hands, are the caregiver? That's pretty good showing. Okay.
You stole my intro.
I didn't want to steal. I was curious. Okay, so we'll let her do that again to get a better reading. How's that sound? But it gives me great pleasure to introduce Natalie. She's going to give her time and expertise with us. So give her a warm welcome. Colorado welcome.
Thank you. Thanks, John. Appreciate that. Can y'all hear me okay? I have like a really loud southern voice as it is, so I get nervous with microphones. Sorry. So I'm going to have you all do that again. How many people in this room identify themselves as family caregivers? That's a lot of folks. That's a lot of folks. My goals for you today are to help you identify yourself as a family caregiver. I suspect there are some of you out there that are family caregivers that did not raise your hand, so we're going to remedy that. We're going to talk about the difference between caregiver stress and caregiver burnout and what those symptoms are, and also how to practice self-care, how to have difficult conversations with your loved one, with the care receiver, and also set some boundaries. Yay, social work word. So we're going to cover a lot of ground today, and I feel like some of it may be like, where is she going with all of this? But the goal is for you all to learn some tools to be a more effective caregiver. And also for you care receivers to maybe understand a little bit more about what your caregiver is dealing with. So what is a family caregiver? 28% of Americans are family caregivers. Family caregivers provide an average of 20 hours a week of care over and above what they're giving for their children, their grandchildren, their jobs, their spouses. Women, primarily caregivers, 66%. And that makeup of that typical family caregiver, 49-year-old woman caring for her 69-year-old mother, but she does not live with mom. She's got her own family and her own job outside of being that caregiver. So that's what a family caregiver looks like. But what you do is what makes you a family caregiver. So a family caregiver is anyone that's responsible for attending to the daily needs of another person. But the family part of that means that it's a family member, it's a friend, it's informal, it's not paid for. The care that you're giving is you giving it because you want to, and in some cases because you have to. Common things that family caregivers do: transportation, the housework, the grocery shopping, preparing meals. Half of all caregivers also report assisting with personal care, so bathing, grooming, dressing, those kind of things. So now, knowing that these are common tasks that a family caregiver does, and thinking about your day-to-day, how many of you are family caregivers? Anybody didn't raise their hand before that raised it now? Couple? Okay. Important to acknowledge the role that you play, and here is why. Because 15% of family caregivers do not consider themselves to be acting in that role. Over 90% of family caregivers, once they do self-identify, once they do say, this is my role, this is my job, become more proactive about seeking out resources and skills. And these resources can be everything from reading about caregiving, asking for help with caregiving, so maybe reaching out to family, friends, church members to see if maybe somebody can step in and provide some respite care, talking to a professional about their own health issues, seeing a therapist, those kind of things, arranging for services. This is huge because there are services out there that until you recognize the fact that you are the person that's doing all of this work, you don't tend to pay attention to. But there's meal delivery services, there's respite care providers, there are handyman programs that can come in and help you out so that you don't have to be the one installing all of the grab bars or whatever the case may be. And so that 90%, once they say, okay, I'm a family caregiver, they become more proactive in reaching out and acquiring those services. This is really important too in our current culture. That 90% starts to talk about their caregiving role with their supervisors at work. It's a pretty big deal because we don't get a lot of paid leave in this country to take care of others. And so talking with your supervisor, talking with your employer is a huge step in identifying yourself as a family caregiver. This is the role I play outside of working for you. So along with self-identifying as a family caregiver comes acknowledging that this job is really hard and can be really stressful. So what do we do when we feel the strain? What causes us to feel that strain? Maybe it's caring for a close relative, because caring for a close relative, a child, a spouse, a parent, is more emotionally stressful for the caregiver than if you were caring for a friend or a neighbor. Maybe it's that the burden of care has increased, and so you're feeling more emotional stress. The care duration, you know, a lot of people say, and we just had this experience in my own family, you know, my mom flew out, my grandfather was in the hospital, she said, I'm going to be there while he's in the hospital. 3 weeks later, she's still there. We don't realize when we take on that role of a family caregiver that the duration is not your duration, it's the duration of your loved one's care needs. So the longer you're a family caregiver, the higher your stress will be. Whether you volunteered for this role or you were placed in it because of your maybe role in your family or your birth order, things like that, those are going to cause more stressful emotions as well. And then if you have to start acting as a nurse, acting as a professional, that's going to increase your stress. We also know that caring for those with chronic conditions is more stressful for a caregiver. And that can be, you know, mental health issues, long-term physical conditions, different types of dementias. Those kind of things are more emotionally taxing for the caregiver. This is my favorite slide because this doesn't just go for caregiver stress. This is just stress in general. We all have stress in our lives. So stress is about too much, too many pressures, too much demand. But stressed people can still imagine that if they get everything under control, that they'll feel better, that they'll be able to manage it. They just need one more little thing to put in place and everything's going to be okay. Burnout is about not enough. Being burned out, you're empty, you're devoid of motivation, and you are beyond caring. People that have burnout, caregiver burnout, just burnout with their job maybe, they often don't see that there's any hope of a positive change in their situation. So you can see the difference there. For stress, if there's one more thing that goes right, things will be a little bit better. Burnout, there's nothing that's going to make the situation better. So my goal as a social worker and as a care manager is to help people avoid the burnout by learning to manage the stress of caregiving. And so that is the bulk of what we're going to talk about today. So there's your signs of caregiver stress. These are obviously feelings of anxiety, depression, irritability, having trouble sleeping, typical signs of stress just in daily life. But when you get to the burnout part, you can see that those feelings change to, they're more extreme. So not only are you neglecting your own needs, which caregivers often do, but you're impatient and irritable and sometimes neglectful with the people that you're caring for. You don't get any satisfaction from caring for the person, and you can often become resentful of the person that you're caring for. And that big one at the bottom, that feeling helpless and hopeless. There is a lot of data out there that says that family caregivers are among the most depressed people in our culture because they are not dealing with their own emotions. They're not managing their own stress because they're so caught up in caring for their loved one. We're going to change that. So these are going to be the 4 take-homes for today. If you remember nothing else, these are your 4 directions from me. And now we're going to talk a little bit more about how to maybe do some tips to do these things. So the first part is ask for help. Speak up. Don't expect your friends and your family to read your minds. Tell people what you need. Tell people how they can help you to help your loved one. Spread the responsibility around. You don't have to do everything. One of my favorite things that I recommend to my clients all of the time to spread the responsibility around is to set up a check-in. So you assign a trusted friend or a family member to be the point person. And every week or every other week or every month or after every doctor's appointment, however you choose to do it, you tell that person the lowdown. This is what happened at the doctor's appointment. This is how, our loved one is feeling. This is how things are going. And then that person goes and shouts it from the rooftops if that's what you decide, okay? That person is the one that takes on the calling, the emailing, the text messaging, the, updating the church bulletin, whatever the case may be. Takes that pressure off of you, and you don't get bogged down in those details. Did I call Sue? Did I make sure that, our son knows that, the medications have been picked up, whatever the case may be. You've got somebody else that's doing that for you, therefore taking a little bit of that stress off yourself. Practice saying yes. If you have to do this in the mirror, do it. We're groomed to practice saying no, right? So I'm going to flip that on its head, flip that on its nose. Practice saying yes. It is the most important word that you can say as a family caregiver. Don't be shy about accepting help. It is not, for many people, it is a sign of weakness to say, I need help and I'm going to take it from someone else. It's not weakness to ask for help, because what you're doing is enabling yourself to do something else for your loved one. So practice saying yes and actually follow through on it. Assemble your team. This can be your family, your friends, but this is also your medical providers. This could be a social worker or a care manager. These can be people from church, but have a team that you can call on, not just when your care receiver needs assistance, but when you do, when you need a break. And then probably the hardest thing to do, be willing to relinquish control. This is super hard. This is super hard no matter who you're caring for. I can still remember that day dropping my son off at daycare for the first time and thinking, oh my goodness, these people, they can't do this. They can, they're just going to do it differently. And so for family caregivers, yes, your friend can, make lunch for your loved one. They may not make that sandwich or that meatloaf the same way you do, but at the end of the day, it still tastes good. They still eat it. They're still receiving nutrition and love, okay? Give yourself a break. Most people laugh at me when I say this. And it's because it's true. It's kind of comical to think that you as a caregiver would get a break. So this is what I want you to practice. We like to say 30 minutes a day, but 30 minutes a day may not be realistic for your particular situation. So if you need to start out small, do so. If you need 5 minutes a day to begin with, take 5 minutes a day. But those minutes, no matter how many minutes they are, cannot be spent running errands, making doctor's appointments for your loved one, like nothing that has to do with the care of the person that you are caring for. It has to be something for you. Walk the dog, take a walk, read a book, take a bath, but something for you. The other thing that is really important is to try to get out of the house when you're taking that break, to try to get out of the house, because where does most of the care happen? Most of the care happens in the house. So if you're in the house on your break, you're not really getting a break. You're wondering who just called or who just rang the doorbell, or, did my loved one really just call because he needs something, or because she, wants me to bring her the newspaper, and I can do that in 15 minutes when my break is over. So get out of the house so you don't have the distractors, okay? And then another biggie is to share your feelings. A lot of people don't talk about what they're going through, what they're dealing with as family caregivers, and that's because we feel like we're going to be a burden to our friends or to our family if we say, this is a really hard job and I'm really having a hard time dealing with it. But the fact of the matter is that you're not a burden. You're expressing the difficulties, and you're giving yourself some clarity. You're giving yourself permission to feel whatever emotions that you're dealing with. Practice acceptance. This is a really hard one for me. So focus on the things you can control. You can't wish your loved one's disease away. You can't force your family to help out more. But what you can do is focus on the ways that you choose to react to the problem. So for example, if you know that your oldest son, sorry for any oldest sons that are out there, is not going to say yes to a request, don't ask him. Because all it does when he says no for the 45th time is make you upset, because why isn't he helping? So just take him off the team. Don't make it worse for yourself. Find the silver lining. As cliche as this sounds, for caregivers, thinking about the ways that caregiving has made your relationship stronger, your family stronger, can really be cathartic. Also, thinking about the ways that caregiving is allowing you to give back to your loved one. This is a big one for those of us that are caring for our parents or maybe our grandparents, is to reframe it. I'm caring for this person who cared for me for so many years. Avoid tunnel vision. This one's so hard to do for people because we get so bogged down in being a caregiver. We forget that we exist. So take your blinders off. Stay engaged with things that you enjoy. If that's going to church, go to church every Sunday. Have a friend or a family member or a respite care provider come for those few hours and be with your loved one so that you can remain engaged. If that's going to book club, find a way to go to book club. But stay engaged in what makes you happy and gives your life value. And then also, again, with that sharing of the feelings, but maybe not so much to friends, maybe a professional. Maybe a therapist, maybe a social worker, maybe join a support group or an online caregiver forum. There are lots of ways to kind of connect with people that know what you're going through and share similar experiences. When you connect with a family or a friend to talk with them about what's going on, they don't always relate because they're not in it too. So if you connect with like a support group, something like that, these people are all along for the ride with you. And they're going to really understand and appreciate and validate some of the things that are on your mind. To me, this is the most important step. You cannot forget to take care of you as a caregiver. You have to keep on top of your doctor's visits. You have to keep on top of your flu vaccines and your pneumonia shots, all those things that we don't like to do, because what we know about family caregivers is that you are the ones that will get every single illness that's going around. Never fails. So stay on top of that. Don't skip checkups. Don't skip medical appointments. I like to tell my families that I work with that if you make a primary care physician appointment for your loved one that you're caring for, make one for yourself as well. But I also tell them, if you're going to make a haircut appointment or if you're going to take your mom to get her nails done, then you get to do it too, but not together, okay? Your appointments are your appointments, their appointments are their appointments. The standards, right, of taking care of yourself, exercise, eat right, get sleep, those are kind of things that we tell everybody to do, no matter what stage they're in, no matter what they're dealing with. So I'm going to tell you again. You can meditate like my friend the dog here. We had this like ongoing conversation in my office about whether we should put this up or not, but I just think it's so funny. So even if it's not relating to anybody, like, I enjoy it. So there's our meditating dog in the lavender field. But meditation, deep breathing exercises, practicing mindfulness, those are all really important steps. The other thing, and this is kind of near and dear for me, is that as a caregiver, you need to have plans for your future too. So you need to have your advanced care plans completed. You need to have somebody that's going to make medical decisions for you if you can not make them anymore. You need to have a plan in place if something happens to you for what's going to happen to the person that you're caring for. Backup plans, they're huge. So advanced care planning and advanced directives are not just for people who are sick. They are for people who take care of people that are sick. So that's super important as a mechanism to taking care of yourself. And then again, that continued participation in things that you value. So unfortunately, asking for help, plugging in new services, taking your break often brings up a lot of stuff with the people that you're caring for. Why are you taking that break? Why is this person coming in instead of you taking me to the grocery store? So that means it's time to have some hard conversations. There's our thinking lady. She's thinking about how she's going to have these hard conversations. So first step is to do some prep work. Do some prep work before you have that conversation with your loved one. First thing, form your team. We say that a lot. The team is important. You cannot do this alone. If you have family that is involved in the care of your loved one, have a family meeting. Talk about what you're thinking you want to do. Talk about how other people feel about that. It may be that you say, you know what, I need to get out for an hour a day, or I would like to have, Wednesday afternoons to just do whatever I want to. And so we need to bring in a caregiver, a paid caregiver. And it may be that your sister says, oh, I can come on Wednesday afternoons and do that. Yay, but you won't know until you all discuss it. Then you're going to research your options. You're going to do some homework. You're going to find out what services are available for the person that you're caring for the particular need that you're trying to get met. So if it's that you do not want to make the meals any longer, if that's just something that you're having a really hard time doing because you're also trying to hold down a job and care for your own children, bring in a meal delivery program. Yay, Brandy. If it is time to bring in a paid caregiver, did you know that there are over 350 home care agencies in the Denver metro area? How do you pick one? So pick one, pick two, pick three. I give people 3 choices. Research those ahead of time. Find the ones that really maybe go to where, maybe you live a little bit farther out, so they'll come and they'll travel there. Maybe they will work within your budget, but do that research before so that you can say to your loved one, it's time to bring in a caregiver. We've done some homework. These are the 3 that meet our needs the best. Now you get to pick which one. And have that piece of it be inclusive. Seek professional expertise. So obviously, if there's medical changes, work with your care team, your medical providers. If there are questions about Medicaid eligibility or, things to do with wills and that kind of thing, contact an elder law attorney. Work with a social worker or a care manager to kind of bring all the resources together. But bring in professional expertise. You don't have to do this by yourself. That's why people like me have jobs. And then learn to back off. This is super hard for people. It is okay that this conversation does not happen when you want it to happen, how you want it to happen. It is okay if this conversation happens a month down the road because your loved one is not quite ready to broach those subjects. Unless it's a crisis, then that's a whole nother issue. We have a saying in social work. It's probably the first thing that we learn when we walk in the door, and that's that sometimes we have to set our clients up to fail. Sometimes we have to set our loved ones up to fail. It's super duper hard to do. It's even harder as a caregiver. But if your loved one does not want to stop driving and doesn't want that transportation service, maybe they need to drive one more time. Maybe that's when they get the ticket. Hopefully they don't get in an accident. But if your loved one doesn't want to not change the light bulbs anymore and wants to get up on that ladder one more time, sometimes we have no choice but to let them do that and kind of prove themselves wrong. And then we can say, hey, look, we have remedies for these things. So be okay that it doesn't work out exactly how you want it to, but be prepared when they're ready to have the conversation. So you've done all your pre-work, right? And now you're going to actually have the conversation with your loved one. Be straightforward about the facts. This is not the time to refer to what happened to your neighbor when she didn't listen to her kids or when he didn't listen to his wife. We don't want to point out other people's issues. We don't want to just talk about the negative stuff. We just want the facts. You're going to phrase any concerns that you have as questions. So, really good examples. When you're driving, right? So you're driving. I notice that your reactions aren't as quick as they used to be, and I'm worried. That's a concern. But you're also opening it up for that person to say, well, why are you concerned? So that you can kind of continue that conversation. Also, one of the favorites in our office is to, I've started to think about like what's going to happen with me down the road, and so what would you want? Then you're both engaging in conversation. Or another one, let's talk about what you would want down the road. Let's start with what's important to you. Let's identify your values, what's important to you, instead of just throwing, resources at them. Actually find out what makes them tick, okay? Listen. I put it 3 times because it's probably the most important part of having any conversation, is to actually listen to the person when they're giving you feedback. Give them room to get angry. This is a hard part of my job. I have families that come to me every day saying, well, I'm trying to have these conversations with my husband or my mom or my sister, and they're getting angry and they're leaving the room. That's okay. This is hard. It's hard to lose your independence. It's hard to need to rely on somebody, but it's also really hard as a caregiver to feel like you're being overused. So it's okay for everybody to get angry. Just don't let it escalate. Take a step back. If you're apt to maybe get angry and the conversation's taking place at home, maybe that's not the best place to have a conversation. Maybe you all go out to lunch. Maybe you go on a picnic in the park. I don't know. But you've got to find the right setting to have a conversation so that if somebody gets angry, they can't get up and walk out the door and slam the door behind them, okay? Which I have seen happen. And then refer to yourself and your thoughts. This just ensures that the people that you care for know that you are thinking about them and that you care about them. So what if your loved one resists your attempts to discuss your care plans? First of all, we know that that's going to be okay, right? It's going to be okay. We're going to set some boundaries, though, because you still need to do what you need to do to take care of yourself. So let's set some boundaries. First thing, ask yourself what saying no to their request really means. If you can figure out why you continue to allow a boundary to be violated, it is easier to change that violation. So is it guilt that keeps you from saying no? Is it a desire to please? Is it fear of making your loved one mad? If there is another reason you say yes when you really want to say no, it's possible that no amount of saying yes is going to change the way you feel. And so once you've dealt with the underlying reasons that you want to say no, but you keep saying yes, you're going to feel more comfortable saying no, okay? You're going to feel more comfortable setting those boundaries once you've identified kind of what keeps you hooked, so to speak. Let me back up. So the other thing is that very often people feel like saying no to a loved one's request makes that loved one feel rejected, or that they are rejecting that loved one. You're not rejecting them. You're simply turning down a request. You're simply saying, I can't go to the grocery store today. I can't take you to the doctor today. You're not saying, I don't love you. You're just saying, I can't help you right now in this moment with that request, okay? Determine if the request is something you and only you can fulfill. So, could a part-time caregiver be the answer to the problem? Could a housekeeper be a solution? Are there other family members that could maybe pick up some of the slack, so to speak? But really determine why you're wanting to do all of these things yourself, and if it's necessary for you to do it, or if it's necessary physically for you to do it, or if it feels necessary emotionally for you to do it. And then sit down and discuss with your loved one what you can and what you can't and what you won't do. We call this the line in the sand. And everybody's line in the sand is a little different. I've had caregivers say, once I have to start showering or helping with toileting for my loved one, that's my line in the sand. I can't do that. It feels uncomfortable to me, or I don't feel skilled enough to do that. I've had caregivers that say, once they can't get up and down the stairs anymore, I can't be the caregiver because I have a bad back and I can't do that. I had one woman who, pretty remarkable family, they're caring for a 100-year-old mother-in-law and a 5-year-old child with Down syndrome. Right? So this woman says to me, I said, what is your line in the sand? And she said, when caring for my mother-in-law starts to take away my abilities to care for my grandson. That's my line in the sand. And she said it out loud with no hesitation in front of her husband, so in front of her mother-in-law's son. And that was it. And that's the line in the sand. So you've got to be open and honest about what you can and you cannot do and what you will not do. Because what you can't do and what you won't do are two different things. the bottom part, repeat these steps until you're comfortable. So this is a process, and caregiving is a marathon, not a sprint, right? So setting boundaries is really hard to do, just in general, so it may not work the first time out of the gates. It may not work the 10th time out of the gate, but eventually you will feel comfortable saying no, or I can't do that. And so with that comfort comes some solutions, and then your care receiver sees that you're comfortable, sees that you still care about them, that you still love them, but you just need to take care of yourself as well. Okay? Sorry. I like this saying. Self-care is not selfish. You cannot serve from an empty vessel. So step one we talked about today is identifying yourself as a family caregiver. Step two is identifying that once you identify as a family caregiver, your stress goes up. And then how to combat those signs and symptoms that say I'm too stressed before they get to burnout. Because when you get to burnout mode, you are not a safe caregiver anymore. You are not okay to give care. And so we don't like burnout. In my world, burnout is a very bad thing. And then with that burnout, or with that stress, managing that stress by taking care of yourself, by asking for help, by taking your breaks, by practicing acceptance, then you get to this place where you are armed with some tools maybe that you can have a hard conversation about what you need to take care of you so that you can be a better caregiver. And hopefully also set some boundaries for yourself that you won't violate any longer, or that you won't allow to be violated, because it takes two people to violate a boundary. So if you say, I'm not going to do this, or I cannot do this, or I won't do this today, you have to stick with that, okay? Because once it happens, then it's enabling, okay? So you're not selfish if you're taking care of yourself. You're filling your tank. You're keeping yourself going so that you can provide the care. And so I want to finish by asking this question. Will all of the caregivers please stand?
Caregivers, please. Stand up. Give yourself a hand.
Thank you all so much for the hard work that you do. I know that caregiving is not not always rewarding. I know that it's not always valued in our culture, but there are people that know that you guys work super duper hard to take care of the people that you love, and without you, those people would not be where they are. So thank you again, and thanks for having me.
There's time for questions. We do have a few minutes for questions. Anybody?
Yeah, any questions?
That was a brilliant presentation.
Thank you.
Absolutely brilliant.
Yes, ma'am.
How do I know if in the past when I really, really needed a caregiver, if I was a good care receiver? How could I be maybe a better care receiver?
That's a really good question. So I know for myself that I am the world's worst patient. World's worst. So as a care receiver, you know everything about how to take care of yourself, right? You know, yep, you know what makes you feel comfortable, and you know how you want to be treated. As a caregiver, you know how you want to care for that person, right? And sometimes those things don't add up. Kind of like being a parent, right? So there is no easy way to say you would be a better care receiver if you did this, except for this one true fact. Care receivers acknowledge the work that your caregivers do. That is how to be a good care receiver.
I didn't even know my sister was a caregiver, but she did everything.
And that's
for me.
it. You have to acknowledge it. You have, so hopefully today you know that if your sister went to the grocery store for you, or helped you pay your bills, or managed your medications, those are caregiving tasks. They are a caregiver. They are your family. And that is how you help them to feel like they're doing a good job, so then that they are motivated to be better caregivers, and then you are a better care receiver. Does that answer that question?
Yeah,
Okay.
thank you.
Yes.
You're welcome.
Yeah, can you get, yeah, way in the back, okay.
Your entire lecture has been to help people take care of themselves and not arrive at the time when they're angry, the caregiver.
Yep.
But there's going to be a time with some caregivers, we're not all saints, when they're going to be angry.
We're only human.
And a little bit like the rule of thumb for avoiding chicken baby syndrome, it's okay to put the baby in a room safe and leave for a little while. What are the equivalents for the caregiver?
Yep. Good question. So, similar, you are okay to, as long as your loved one is safe, walk away if you're angry. That is A-okay. If you know that the situation is not safe for to leave your loved one, then call a neighbor, call a friend, to come over and just give you some respite so that you can leave, because that's kind of more emergent, right, in the moment. But if you know that the situation is going to continue, this is the same fight every day, right? We have the same argument every day and everybody gets angry. Maybe it's time to think about getting the care receiver out of the home for a period of time. So maybe adult day program is a good opportunity. Maybe it's a support group setting where the care receiver gets some support and the caregiver gets some support, but they're separate for that hour or so. There is, again, no easy answer, because caregiving is just, it is what it is. And so you just make the most out of it every day. But I would say, again, similar to what they say about, never shake a baby and it's okay to leave them, as long as they're safe, put them in a safe place. Do that with your care receiver. And it's okay to say, this situation is really ticking me off and I'm really angry, and so I need to take a step back. And for some families, they need like a code word that signals like this is where it's about to blow, and everybody needs to take a step back. And so maybe have a code word that when things start to get a little bit too much, you can say uncle or whatever the case may be, and everybody knows that they need to just go to their respective corners. So those are just a few thoughts.
We're gonna have to get set up for lunch.
Okay.
So I want to thank you very much for what you
My
did.
pleasure.
Let's show our appreciation. Are you going to be around this little area? Natalie will be around the area here for a little bit as they set up. If you do have individual questions that you think she might be able to help you with, she'll be right up front here for a little bit. So take advantage of the talent while you got it.
Thank you.
Okay.
Thank you, guys.